Good afternoon. I think that we are ready to start our webinar. Welcome. My name is Della Schmidt. I am President and CEO of the Greater Burlington Partnership, and we are so excited because the moment that we've all been waiting for many, many weeks has finally arrived, and we are starting to reopen our businesses during this COVID-19 experience that we're all going through. We are super excited to be able to share with you this first in a series of tools that we're calling Reopen Toolkit. And our toolkit is being sponsored by Minky and Company. We have a short video for you to enjoy.
Hi, Burlington area. I'm Sally Boyer with Minky and Company. We are the presenting sponsor for the Reopening Your Business Toolkit. Today's webinar will be available at greaterburlington.com. The toolkit will be a great resource for reopening your business, including guidance, signage, and customer relations. At Minky & Company, we are happy to be a part of the process of moving forward together as a community.
Exactly. We are all excited to be moving forward together as a community. And so we're going to begin that today by offering our listeners and those who might view this video later some expertise and some insights from several different panelists. So let us begin with our public health team. We're very pleased today to have with us Gina Harden, who is the Des Moines County Emergency Manager. Also, Krista Pogamiller, who's the Director of Des Moines County Public Health, and also Tammy Shipman. Tammy Shipman is from Great River Health, and she's the liaison to Public Health. And so these three ladies are going to share with us some things that we can expect as we reopen our businesses under these new guidelines from the governor. Ladies.
Hello, everyone. Welcome. You're in the Des Moines County Emergency Operations Center, so we're coming to you today from here. I'm going to start out. I'm Gina Harden, and I just have a few general tips to give to you. We want you to continue to encourage your staff to take their temperatures twice a day, and that you as a facility need to set a baseline as to what that level of temperature that these employees have before they enter your facility. Want you to continue to encourage your employees to have good hand washing and to use hand sanitizer. And obviously, the things we've been talking about for years is the etiquette for coughing, sneezing, and hand washing, having good etiquette with those things. We're still encouraging employees and people to wear homemade cloth masks when they're out and about. The same thing applies when they're coming to work in your facility. Make sure that you're still following the CDC guidance on cleaning and disinfecting. Constantly or very, very frequently cleaning and disinfecting all those high-touch services like computers and door handles and light switches and those kind of things. Keeping your employees 6 feet away from each other if at all possible. Posting signage on your doors. And importantly, if you have an employee or a customer that comes into your facility and they happen to become ill while they're there, make sure that they know, ask them to share that information with management and have them leave the facility right away and go home and call their healthcare providers. So, and obviously from the very beginning, we've been telling everyone to stay home if you're sick. We want you to continue to do that and emphasize that with your employees. So those are the general tips I had. I'm going to turn it over to Krista.
Hello, everyone. Krista Pogamiller from Des Moines County Public Health. I want to start out by thanking all the community partners for so actively helping us flatten the curve for COVID. It's been great response from the community, from emergency management, the hospital, and all the partners out in the community as far as to help us staying home when they're sick and really just following the guidance from Iowa Department of Public Health. And the Iowa Department of Public Health has put out some guidance on the reopening of businesses as well. Rachel's going to send out a link to be able to access that site, but I'm going to talk a little bit about that guidance that was sent out. This guidance is based on it gives some specifics about cleaning and disinfecting for businesses as well. Again, it reinforces the hand washing, a lot of things that Gina just talked about, the 6-foot distancing. Inside the guidance, you'll find those hyperlinks that you can also get some posters to be able to post at the doors talking about symptoms, things to look for. If anyone becomes ill, who they should reach out to. There's also a guidance in there on using face masks. Again, very important. If you're going to encourage your customers to do that, as well as there's a IDPH business guidance relating to preventing, detecting, and reporting outbreaks. So the outbreak guidance really gives you tools and algorithm for screening employees, as well as who to contact should there be any kind of an outbreak at your facility. Again, as Gina mentioned, making sure people are taking their temperature before coming to work or as they enter the workplace, and then making sure they notify the facility or the business if there is any symptoms during the working day. One of the things that recently changed was the guidance as far as remaining home and isolated. So previously it was 7 days. If someone had symptoms or tested positive, they needed to remain at home for 7 days plus 72 hours without symptoms. Recently, this last week, that was changed to 10 days. They're finding out that that virus is shredding for a little bit longer. So now if someone comes and they've had a test for a positive COVID, they would be home 10 days plus 72 hours symptom free. We are doing more testing. As far as the Iowa Department of Public Health, we're increasing the antibody testing as well as the serology testing or the antigen testing. So we're actually testing for the virus. So we would know if someone currently has the virus or someone who has been exposed to the virus, and that would be the serology testing now that they've built up antibodies. So definitely making sure that we're getting out to the folks that are hospitalized. Our testing guidelines says any healthcare worker or essential personnel that has been exposed would be eligible to have the testing. So if there was any type of positive COVID at an essential workplace, they could contact their primary care physician to have testing done. And if there's ever any questions, they can definitely contact our local public health as well. And I'm sure as anyone who has a respiratory or a fever would fit into those criteria. They have also extended out that criteria a week ago. By the CDC has now included other screening tools. It's always been the cough, shortness of breath, the fever, but now they've also included some chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. And again, all this information is all posted on the Iowa Department of Public Health website. For your convenience, we will be sending out that link. There's also a recent, for any restaurants in our area, there's also a recently released reopening criteria operations restrictions for COVID-19 that was put out by the Department of Inspections and Appeals. And that really talks about limiting indoor outdoor seating, capacity to 50% of normal. Gives very much the parameters as what the Department of Inspections and Appeals is asking for any restaurants that are opening. I know that at this point, we are not ready to open yet. So, I mean, we've not gotten the proclamation. We're hoping that'll be the end of this week. But that information is also a link that I sent to Rachel. I think that'll be pretty close to the same information that we'll get once our county is opened back up. I think that kind of covers what I have. I think I'll turn it to Tammy.
Hi, everyone. I'm Tammy. I am with Great River Medical. I will echo what these guys have said. I think the biggest key to being successful is to follow the guidance that we've had all along, the hand washing, making sure that you have the tools available for people to do good hygiene, screening before they enter the workplace. And I think one of the hardest things is for employers to support employees not working if they are ill. If we need to all be responsible, and if we have symptoms or if we're not feeling well, it's just the best thing to not work. And I know that's an issue when you're depending on employees, etc., but that's something to definitely keep in mind. I'll address a little bit what to do if you have an employee who is ill or has symptoms. They can call the call center at the hospital, and there's numbers for that. It's listed on the website. I'll give you those numbers though. The first one is 319-768-1009. There's an 800 number, 800-871-3313. When people contact that number, they are talking to usually registered nurses who will go through a little telephone screening process with them. And should they feel they meet the qualifications to be tested, they will help with a referral to one of our respiratory care sites, which we have at Great River in Burlington. We also have at Fort Madison and also at Henry County. I think one of the other things is be aware that even though there's going to be some probably almost like post-traumatic reactions from people. People, we have a lot of people that are afraid of germs, afraid of being sick, and rightfully so. Others that are extremely concerned about that. There are a lot of links and available areas on the CDC sites for mental health care during COVID. There's also a disaster distress hotline number that people can call, and that number is 1-800-985-5990. And if it's people that really don't want to talk, they can also text this hotline, and you just text to the number 66746, and then you type in "talk with us," and they will respond and register people. That is a free service, and they will, if they feel it's beyond their scope to help, they will make referrals and assist people in that kind of stuff. And I believe that's all I have as far as to start this off.
All right. Well, Gina, Krista, and Tammy, thank you. That was great information. And I particularly appreciate thinking about the fact that, yes, our consumers, our employees coming back into the workplace, they're going to have some concerns. They're going to need some reassurances. And that's absolutely foundational in this toolkit that we are launching. And so for our business partners who are listening, in addition to helping you with a checklist of what you need to be doing as far as maybe new cleaning policies or new training policies, we also have customized signage that you can place on your doors and in your place of businesses that reassure people about the steps that you've taken. And we're offering the opportunity to co-brand that so businesses can contact us and use their personal logo on these new posters that will help reassure customers that we're taking all the proper steps as advised by the Iowa Department of Health. So I'm really glad, Tammy, that you touched on that. So ladies, I'm going to ask for you to kind of hang with us. We're going to shift our attention to a couple of businessmen who've already been on this journey of operating their businesses in shutdown and restriction mode. And then when we get into Q&A, we might have some questions for Gina, Krista, or Tammy. But at this point, I'd like to introduce Bob Huffman from Huffman's Farm and Home. now, Bob has, as an essential business, has already been operating his businesses during COVID-19, following all of the recommendations and restrictions. And so he's going to share with us what he has learned, both from a standpoint of the business customer relationship as well as the employee relationship. So Bob, would you like to jump in here?
Sure. Thank you for having me. Yeah, we, ever since everything started developing with the COVID back in the beginning of March, we started taking different precautions, and like everybody, we were just trying to take in as much information and learn what best practices, what we should do for our employees, what we should do for our customers, and try to put all that together and make the best decisions we could moving forward. We have locations in Illinois and Iowa, so if there's anybody on there from the Illinois side that's listening, I have a little perspective because it is a little different with some of the requirements on Illinois compared to Iowa. But when both governors made the decisions to start shutting some businesses down and Illinois issuing the stay-at-home order, we of course at first were wondering how that was going to affect us. But being in a agricultural, hardware, pet food, different things like that, we are deemed an essential business, and so we were allowed to stay open. So with that, we wanted to make sure we were doing things the best we could for our customers and employees. So, some of the things we've done from the very beginning, is our employees, especially at first, had lots of concerns, questions, with when this was beginning. So we were just trying to be very understanding, communicate, open lines of communication with the employees to make sure if they had questions, they could ask us. We would find the answer if we didn't know it, let them know where we're at, what we're doing. Communication was key. Been very fortunate. Our employee team has been unbelievably brave and solid, and been just trucking right along, taking care of our customers and doing a great job. They very easily could have had some real concerns and opted not to continue to come in, and we would support that. Each person has a different view on this, and but we did not have any issues from that end. We took the proper precautions from the beginning with locating and making sure we had plenty of hand sanitizer, Clorox wipes, all of those basic necessities needed with this. We instituted additional cleaning protocols, multiple times a day, doing extra wiping down of shopping carts, of commonly touched surfaces, asking our cashiers to, hand sanitize after each transaction for their benefit and our customer, trying to do all of those things that have been recommended and we've all heard about, I'm sure. We purchased some made sneeze guards for all of our stores and our locations at the checkout counter, our customer service counters, to provide added protection for our employees and customers. We instituted a policy of a request of our customers for one person per shopping cart. We put directional arrows in the stores to encourage our customers for one-way flow down the different aisles. We put the marks at the checkout to keep a 6-foot distance from one customer to the next. So those are, all the things, and that's pretty common, I think, with the grocery stores and the places that have remained open. So we've been trying to do the best we can to keep everyone safe and healthy, and at the same time be able to take care of our customer needs through this time, because we have been fortunate with everybody spending a lot more time at home and not having as much on the go. They've decided to focus on a lot of home improvement projects and yard projects for spring, so it has been extra busy. But we've been very fortunate. One thing I can say is back to what the folks from Des Moines County said. We have been tried to be extra cautious. We've had a couple instances where someone was maybe presenting with symptoms or concerned about someone they had come in contact with that had presented, and we do fall under, following the some of those COVID guidelines due to the number of employees, and we followed those rules, and we've always just erred on the side of caution. There's been times where I the person says, well, I know somebody who knew somebody that talked to somebody, that has COVID, or think, what should I do? And we'd look at each situation individually and try to make the best decision. But again, if it ever came down to it, we were always like, okay, why don't we take an extra 2 days or an extra 72 hours and just quarantine to be sure that we don't bring, you don't come back too soon, or that it is truly a just a symptoms unrelated to COVID, because it wasn't worth, bringing somebody back and then infecting another employee or customers or anything like that. But, knock on wood, so far we've had no issues like that. But again, I just think it's best, and what we've chosen to do is just err on the side of caution for everyone's safety. So those are the things we're doing and been doing, and as we've remained open over the last 6-8 weeks.
So, Bob, I do have a follow-up question. Again, because you've got a few weeks of experience on some of the businesses that unfortunately were required to shut down altogether. What has been one of the biggest challenges that you've had to navigate as far as addressing concerns of your customers, or have you experienced the need to address any concerns that your customers might have about feeling comfortable and safe coming in to make a purchase?
We really haven't had too many, or really haven't had any issues with customers. I mean, we, from the very beginning, through our Facebook marketing and our signage and that we placed on, we've just tried to communicate to the customers. One, at the beginning, there was a question, are you open? Are you open normal hours? So, those were questions we were getting, people wanting to know. So we wanted to get that out there. One thing we did from the very beginning to try to put customers at ease, especially some of our elderly customers who may be more susceptible to COVID, is we instituted a curbside pickup right from the beginning, where they could call in, tell us what they want. We would shop it, get it, and take it out to their car. We also offered, delivery in some instances, if that's what was necessary to get them taken care of if they did not feel comfortable coming to the store. And again, all that was done through our Facebook page and in the store, just trying to communicate there. And then I feel that the steps we took, that was along with a lot of the grocery stores and the other retail outlets. I think they saw that we were taking it serious and doing what needed to be done, to do everything possible to prevent an infection from occurring, and everything. So it's been pretty smooth from that standpoint. I think the ones that are truly not comfortable, they've stayed at home more, or took one of our abilities to still get them whatever they needed, while the others have been satisfied with the things we've tried to do to keep everyone safe.
Well, thank you for that. We're going to circle back to you in just a minute. I know that we've got some questions coming through, and Economic Development Director Jeremy Hess is going to kind of lead that Q&A section. But for right now, we're going to move to our final panelist, Chase Gibbs, owner-operator of the Buffalo Tavern and Coal House 337, also Buffalo 61 Bar and Grill, which has been allowed to open somewhat under the new restaurant guidelines. So Chase, we're very, very anxious to hear how things have been going for you and what tips and advice you might have for other business leaders.
We're staying really busy, that's for sure. So we have, of course, we're right across the street from Bob down here. So I've kind of got some notes on everything here, listening to him. It's a lot of it's repetitive with what he's dealing with. I can tell you right now, the main thing that we've worried about is just cleanliness across the board, nonstop. Wiping down door handles when people walk in, wiping down going to the restrooms nonstop, constantly cleaning the restrooms down. From a restaurant perspective, there was 26 different recommendations that we had to. There's 26 recommendations. And there was, I believe 5 of them were required, 21 of them were recommendations. They didn't all fall into our classification of our restaurant. So basically what we did was we have to have a 6-foot space between all of our restaurant, or between all of our patrons in our restaurant. So what we did was everybody thought we were going to move tables out. We did not move tables out. What we did was we just marked certain tables off as being unable to be used. And then on the tables that we did use, and when you enter the restaurant, we removed anything from the building that a customer could touch except for their table. So there's no high chairs when you come in. There's no booths, no booster seats when you come in. There's no condiment caddies on the tables. There's no napkins on the tables. The only thing that is on a table that can be used is a bottle of sanitizer. We actually, we purchased 18 gallons of sanitizer that I just got delivered in the other day. So we're sanitizing everything nonstop. So I saw somebody ask about sanitizer. I have a contact for that. So we did that. We cannot have parties of 6 or more people sitting, or more than 6 people sitting together. So if somebody comes in with a group of 10 people, first of all, the governor is not requiring, but has asked that people make reservations. Obviously, people aren't making reservations. They're just walking in. So we have to seat people not together in groups of 6 or more. So 6 or less at each table. Then we have to separate them out, make sure that they're 6 feet apart from each other. I have made it clear that when people bring children in, that children cannot just be running around the restaurant causing havoc, along with drunk people also. Speaking of drunk people, people are able to come in, but once they have their meal and they're finished, if they want to have a drink or 2, that's fine. But people are not able to just sit in the restaurant and drink all day, because all their local actual bars up the road are closed. Because we're a restaurant, we're allowed to be open. I actually only have 3 seats at my bar right now, because again, they have to be 6 feet apart. Plus we have to allow for people who are coming in and still doing carry out to have a safe place to pick their orders up too. There's so much that goes into all this. So with my staff, we check temperatures when they come in the back of the building with an infrared thermometer. If anybody has a fever or they have any signs of the virus, they have to leave. Once they're clear of the symptoms, they can't come back to work. I believe it's for 10 days right now. I've had a few employees call in sick with fevers, which is a symptom, and they did not like it. They couldn't come back to work for 10 days. So you have to be very adamant about checking temperatures. Another thing is that when customers come into the building, you do have to instruct your hosts or whoever to ask your patrons if they have been exposed to anybody who has had the coronavirus, if they've been exposed to it, or if any of them is showing any symptoms. If they are, you have to ask them to leave the building immediately. So we've dealt with that too. We haven't had any issues with anybody yet though. The Iowa Restaurant Association, for those people who are out there with restaurants, I'm a member of the Iowa Restaurant Association, and of course they lead the charge, kind of cheerleading for us restaurants. So I follow the Iowa Restaurant Association's webpage very close. They have daily conference calls that you can get in and listen to. It can be tough. They fill up really fast, but they generally will put all the information out from that conference call right afterwards. So if anything changes, you can find out from the Iowa Restaurant Association. As far as the front of the house, anybody for me who works is required to wear a face mask right now, and I do require them to wear gloves also. And they do change their gloves as they clean tables down, and they have patrons who leave. We also, as far as the face masks go, they don't like it, but it's just kind of how it is for now until I hear different. I did meet with Mike from the health department the other day, Shelagoski. I have a pretty good relationship with him, and he said at this time to go ahead and keep the face mask too, that the governor is still recommending that. So back of the house, at the back of the house, as far as my staff goes, if they're not showing any signs of coronavirus, because it does get very hot back in the kitchen, it is at their discretion if they want to wear a face mask or not. I would say about 50% of them do, 50% don't. They do all wear gloves back there so that anything that they come in contact with, they're constantly changing gloves all day long. The overall, I've been here most of the time when this has happened. And as far as the general public coming in, I would think that I was definitely much more concerned about it than the general public is. People aren't scared to come out. People aren't scared to come in. I have not had any issues at all. The thing that I keep hearing from people is people are like, it's just nice to get out. It's so nice to get out. It's so nice to get out. I have had a lot of people thank us for reopening because they could come in. Business is still through the roof as far as the carry out and the curbside and the delivery goes too. And that's one thing that we're still offering for people who are scared to come out at this time or don't want to. We do offer those services to them. But the people who are coming in are just coming in to enjoy themselves. We have had no issues at all. So people are excited to get out of the house. So I think that, you know, you do need to be cautious with everything to make sure that we stay safe. But at the same time, people are going to come in, and it's not like they're scared coming into a haunted house or anything like that. People are coming in and they are just excited to get out. So do you have any questions for me, I guess?
Yeah, hey, thanks, Chase. It's Jeremy Hess here, and I appreciate all that information. You did just take one of my questions, was just kind of what the feeling of customers is, and just kind of how do we start to gauge that. And Bob, I know you touched on that too, that most folks are glad to get out and do their shopping and so forth and take the precautions. So appreciate you guys sharing that. So one question, I'm just going to throw it out, a little bit of a jump ball here. So how is 50% defined? Is that by fire code? Is that by who tracks that? Is that and who's monitoring that? Is it the law? Is it so? Just talk about 50. I think we're going to be hearing a lot about 50% of capacity, and how's that measured? Jump ball, anybody?
I got it. I know as far as I went, I just took our fire capacity, divided it in half, and subtracted the amount of employees I was going to have working at a time. So I think our fire capacity is 155. So let's say 160, 80 minus 10 to 15 employees working at a time. You come in here, there's probably not more than 65 to 70 people. Nobody's monitoring it. Nobody's been in. It's about like those PPP loans that everybody's getting. Nobody knows what's going on. But it's just, I use that simple formula. And with us, with the spacing in the restaurant, with the tables anyways, we can't get more than that many people in here at once.
Great. All right, thanks. I'm going to maybe throw this one to our folks from Des Moines County Emergency Management, Gina Harden and her team there. Just so we've heard about thermometers. Obviously, we're not doing the oral thermometers and other kinds of thermometers. But what's the accuracy of the thermal, and how does everyone feel about the temperature scans that are being done remotely?
So I'll go ahead and answer that. So the Iowa Department of Public Health, when this all first started, I asked them if they had specific recommendations about thermometers, and they do not. As far as what we're using at Public Health, we use the infrared. And a lot of places use the infrared just for the fact that they don't have to have contact. They're able to take the temperatures and just do that without actually contacting a person and having, of course, we obviously still wipe those down as they move from location to location, but that way you don't have to worry about the actual contact on the forehead. And they are very accurate.
They are accurate. I guess that's the bottom line, right? Yeah. So let's put this out. I'll start with you ladies there and talk about, so everyone seems to be doing a little bit something different with masks. Talk about masks and so whether they're mandatory, whether they're highly suggested, clear science or opinions on the effectiveness thereof and so forth. So as our businesses think about reopening, should they make masks mandatory for folks coming in? Should they highly suggest it? What's Where are we at?
Well, I know the CDC highly recommends masks. And so remember that masks don't take the place of social distancing. People are still going to have to be the 6 feet apart. So I think that, you know, as far as employers who want to have their staff required to wear masks, again, there's just the highly recommended. There's no mandatory of wearing masks. The masks are actually good to protect others from ourselves. So, you know, that way we're not having any droplets that are leaving us and could potentially contaminate someone. I always encourage people, if they're taking off their masks, though, you've had exposure on the outside of that mask, make sure you're using good hand hygiene after you've removed those masks, because otherwise, if you remove the mask, touch your face, you're also exposing yourself as well. So I think it's just a personal choice as far as employers, if they're asking their staff to wear those. And again, highly recommended from the CDC.
Okay, great. If there's other questions out there, keep them coming. And I know that we had one question about supplies and masks and gloves and so forth, and we'll make that contact offline and connect you with that. So I had another question here. So Bob, from somebody who's had a business open the entire time, and maybe Chase, you can jump in here too. So somebody who's stayed open, somebody who's recently opened, what would you say from a business standpoint? What are 3 things maybe, if you can come up with 3, that our folks watching, business folks who are about to reopen, would be best practices, or 3 things that you could think of that would be helpful to them?
You know, I go back to the communication, just communicating with your customers, whether it be you know, through your social media or, you know, through signage in the store or through action, showing them what you're doing. That, you know, I think people, at least our customers, they want to know that you're taking the situation serious and you're doing everything that you can to put your best foot forward to keep them and your employees safe. I mean, there's still a risk, no matter, you know, when we're out and about and everything through this, you know, but you need to observe the CDC guidelines. And I think communicating and showing your customers that you're doing everything you can and doing the best you can, I think that means a lot and gives the customers a comfort level that to come and shop in your store. You know, that's the big, and I think I expand upon that with the act, you know, but. And then the second thing is, I think, is the, you know, communicating with the employees to make sure they understand what we're trying to do and to listen to our customers, be honest and open with everything that we're doing, any challenges or questions they have, to get them an answer as quickly as possible. And I think those are the things that we've done and has worked for us, is just trying to have good open communication and doing the best you can. Because I mean, I'm sure there's things that slip through the cracks just like at any times, but you know, it's definitely not until we're doing the best we can and just really putting forth that best effort. I think customers appreciate that, and so do your employees, and then they, you know, because employees, you know, our employees, I know Chases and everything, they want to be at work. They don't want to be, you know, they want to get back to normal. They just want to do it safely and take care of their customers and themselves.
Chase?
Yeah, I've got a few different things here too. I mean, it's kind of all following up on what Bob said. The first thing is cleanliness all the time. And the thing with the cleanliness is, obviously I can't go around and clean everything in all 3 restaurants. I can't clean everything at Buffalo 61 on my own. So I have to assign tasks to everybody, but it's not just assigning the task. You have to follow up nonstop, because some of the younger staff, if you have younger people working for you, they may not take this quite as serious as everybody else. So I have to follow up nonstop to make sure that the stuff is being done. And I always tell them, if they ask if they need to do something or not, I always tell them, if you have to ask me if you need to do a task, then you probably need to do it. You shouldn't have to ask. And what happens with that is I tell them, I'm like, you need to think about all of these patrons who are walking into the building and what is their perception of you and of the building when they come in. So I always want to make sure that we're seeing things through the customer's eyes as they come into the building. The other thing, and I meant to mention this earlier, as far as the being at half capacity does not mean that we're a half staff, because to enforce these guidelines, to make sure that we're cleaning, to make sure that everything is getting done, we're really having to staff up more than usual for the tasks that we're doing, because we have 2 hosts instead of 1. We have 1 person who's cleaning. We have 6 people working in the kitchen instead of 4 at a time, because we're having to take all these extra precautions to make sure that things are being done properly. And then on top of that, the other thing that everybody really needs to prepare for up in Des Moines County that has happened to me down here is people drawing unemployment. There are several of them that don't want to come to work. So I have had people come back to work who have been laid off, who are absolutely not the same person they were before they left, because they just didn't work for 45 days. And I also had 3 people just decide they weren't coming back to work because they thought they were going to keep getting unemployment. Well, what they didn't realize is that when they decided not to come back to work, you have to report those people, or you can report those people to Iowa Workforce, which I did immediately, because if I had to deal with all those unemployment claims as they were coming in, which we did, then I'm definitely going to make sure and report them for not coming back to work also, as they're supposed to, because that money is coming out of somebody's pocket somewhere. So there are going to be people who think that they can just not come back to work and draw an extra $600 a week through July. So be prepared for that. Be prepared for people who come back to work after 45 days who just aren't in work mode yet.
Yeah, and for all the folks who are watching, we do have on our COVID-19 page, there is a work refusal form that is it's a link to that document you just talked about, Chase, that if you make a job offer to somebody and they refuse that job offer, you just document that. It's a very simple form, and that gets triggers and a follow-up and an inspection of those jobless claims. So so yeah, that's a real struggle. So I'm going to hand it back to Della and let her wrap things up or follow up with anything. So thank you guys for all the answers.
Thank you, Jeremy. Also want to thank Gina, Krista, Tammy, Bob, and Chase. It's been very, very helpful to hear your voices today. I want to remind everyone on the call again, we are launching the Reopen Business Toolkit. There are opportunities for you to have this branded specifically with your logo. So I encourage you to reach out to us and learn more about that. We've got volunteers and staff ready to hand deliver these packets with your logo on posters and things like that right to your business door. So thank you for the presentation, everyone, today. Thank you again to Minky and Company for their sponsorship of our Reopen Business Toolkit. And together we are going to get back to a healthy and robust economy and encourage people to engage in life in a very safe and thoughtful manner. So thanks, everybody. Thanks for tuning in, and we look forward to interacting with you in the days ahead.